Most common form of dementia. Alzheimer's disease (AD) is the most common form of dementia. The term dementia is used to define brain diseases related to memory loss and diminished cognitive skills. Other types of dementia include vascular dementia, dementia with Lewy bodies, mixed dementia, Parkinson's disease and Huntington's disease. An estimated 5 million Americans now have AD, according to the Alzheimer's Association. Women have a higher risk. Nearly twice as many women have Alzheimer's disease as men, according to the U.S. Department of Health and Human Services. Alzheimer's disease also worsens more quickly in women than it does in men. Brain shrinkage tends to be more severe in women with Alzheimer's disease than in men with the disease. Researchers suggest that brain changes in women with Alzheimer's disease may be due to other causes. Your heart and your head are closely related. Heart disease can raise your risk of getting Alzheimer's disease. Other conditions that cause heart disease are also linked to a higher risk of getting Alzheimer's disease, including high blood pressure, high cholesterol, diabetes, poor diet and non-active lifestyle. Heart disease may also be a cause of vascular dementia, which results from narrowed blood vessels in the brain. This leads to a decrease in oxygen to brain tissues. Education can lower your risk. According to the National Institute on Aging (NIA), the more education you have, the lower your risk of getting Alzheimer's disease. You have lower odds of getting Alzheimer's disease if you keep your brain active in old age by doing activities such as taking classes, learning languages and playing musical instruments. Doing group activities or interacting with others also may lower your risk. Alzheimer's disease is a leading cause of death. The Alzheimer's Association states that Alzheimer's disease is the 6th leading cause of death in the United States. About 1 in 3 seniors die with Alzheimer's disease or another form of dementia. In 2010, the Centers for Disease Control and Prevention reported that Alzheimer's disease claimed more than 84,000 lives in the U.S. Only heart disease, cancer, some respiratory diseases, stroke, and accidents caused more deaths than Alzheimer's disease. Unique among causes of death. The Alzheimer's Association also states that Alzheimer's disease is the only one of the top 10 causes of death in the U.S. without any methods for preventing, curing, or slowing it down. Research into a vaccine continues, but so far there are no sure ways to prevent Alzheimer's disease from developing. However, medications can help relieve some symptoms. Alzheimer's disease is costly. With an estimated 5 million Americans who have Alzheimer's disease, the cost for treating the disease continues to rise. In 2016 that figure reached about $236 billion, according to the Alzheimer's Association. The number of Americans with the disease is expected to increase in the years ahead. It's estimated that Alzheimer's disease may cost the U.S. more than $1 trillion by discovered in the last century. A German doctor named Alois Alzheimer first observed Alzheimer's disease in 1906. He described a patient known as August D., who had memory loss and other problems with thinking. After the patient's death, Dr. Alzheimer noted that parts of the patient's brain were shrunken. A psychiatrist who worked with Dr. Alzheimer named the condition in 1910. Linked with the loss of sense of smell. A person with Alzheimer's disease may lose their sense of smell, according to the National Institutes of Health (NIH). Several studies, including one in the Journal of the Neurological Sciences, suggest that changes in the sense of smell may be an early sign of Alzheimer's disease. It's important to note that changes in your ability to smell may also be due to other causes such as Parkinson's disease, brain injury and sinus infection. Life expectancy varies. The time it takes for Alzheimer's disease to progress varies from person to person, so it's hard to predict how long someone with the condition will live. The National Institute on Aging (NIA) reports that older adults usually live 3 to 4 years with Alzheimer's disease. Younger adults who get the disease may live with the condition for 10 years or more. Thanks for watching. Don't forget to subscribe and share.